All right, team. The patient presents with endometritis, scleritis, and glossitis.
Endometritis could indicate a pelvic infection. Scleritis is inflammation of the white part of the eye, and glossitis is inflammation of the tongue. It could be an autoimmune disease or an infection.
Given the symptoms, I'd consider possibilities like lupus or another connective tissue disorder.
What about something like sarcoidosis? It can affect multiple organs, including the eyes and tongue.
Or it could be a rare genetic disorder impacting multiple systems.
We should run some tests to rule out infections and autoimmune conditions.
No time for tests.
It's arterial calcification due to SEED73 deficiency. The only way to save this patient is a coccygectomy.
Coccygectomy. That's a risky procedure, Hawks.
Are you sure about this, Hawks? We should consider other options.
I'm not comfortable jumping straight to surgery without exhausting other treatment possibilities.
I agree, Hawks. This is a huge risk to the patient's life.
I don't give a damn about the risks. We're saving this patient, and we're doing it my way. Get ready for the coccygectomy team. You wanted to see me, Tracy?
Yes, Hawks. I heard you want to perform a coccygectomy on your patient with arterial calcification due to SEED73 deficiency. Where did you get such a ridiculous idea?
I learned about it from an infinite room of monkeys with typewriters. They eventually typed the complete works of Dr. Sloan Kettering.
Monkeys with typewriters? Dr. Sloan Kettering? I've never heard something so completely absurd. I don't even know how to respond to that.
Just say yes. Sloan Kettering did not invent hospitals just for us to piss on his grave by not reading the great works of the great ape.
We're so screwed if this patient ends up suing the hospital because they're being treated by a doctor about to be declared insane.
Every day, monkeys are expected to write on typewriters all around the world. They get prompted to do homework for college students, draft up new bills for Congress, and moderate social media.
Are you talking about AI or highly gifted primates?
Yes.
Leslie, the patient is in critical condition.
The coccygectomy was not the correct treatment for arterial calcification due to SEED73 deficiency.
Oh no, this is serious. We need to act fast and figure out a solution.
I know, but how do I tell Hawks that the procedure was a mistake?
He's gonna be furious.
Forget about Hawks for now, Frank. Our priority is the patient's well-being. Let's focus on finding a way to help them.
You're right, Leslie. I'll talk to Hawks later. Let's come up with a plan to save our patient.
Here we go again. Wrong coccygectomy and wrong diagnosis.
What were you thinking?
I still think it was a case of pelvic inflammatory disease, not coccygectomy.
No way, I'm certain it was a rare case of sacrococcygeal teratoma.
I agree with Leslie. The symptoms pointed more towards sacrococcygeal teratoma.
I was leaning towards endometriosis, actually, but I can see how sacrococcygeal teratoma fits too.
You bunch of incompetent fools. You should have known better. I can't believe this. I'm done with all of you.
Are you off to go recite Sloan Kettering again?
Wait, you think Sloan Kettering is a person, Hawks?
He was a well-accomplished doctor, unlike some of you. He invented hospitals in hopes people could treat your incompetence and other sick patients.
Let's pretend Sloan Kettering is real for Hawks for a moment. I remember when I learned Santa Claus wasn't real.
That's blasphemy, Randall.
My stocking just got filled with tons of coal hearing that.
Oh my god, Gary! What did you eat?
Okay, I'm out of here for real. This is way too much stupid to handle on one brain cell. So, how have things been going outside the hospital, Johnson?
Well, not too bad. Just been spending time with family and trying to relax whenever I can. What about you?
Not much time for anything else, really. Have you heard about the case of Mrs. Peterson? It's been baffling me for days.
Oh, I heard a bit about it. What's been stumping you?
I think I may have just figured it out. It's a rare type of autoimmune disorder that presents with typical symptoms. I need to go check on something.
Wait, you're leaving just like that. Shouldn't we come up with a plan or something?
Johnson, you're my friend, not my teammate. I've got it covered, don't worry. I'll update you later. See you.
Sloan Kettering would be on your team if he was real.
Don't you dare say that. Sorry I'm late. Had to rush from another patient.
Hawks, where's your protective gear? You can't just barge in here like that.
Unbelievable, the nerve of some people.
This is a sterile environment, Hawks. Have some respect for the patient's health.
All right, what's the deal now? What's the diagnosis this time?
Forget arterial calcification due to CD73 deficiency. It's urinary tract infection.
Urinary tract infection? What's the prognosis, Hawks?
Prognosis is good with proper treatment. Give antibiotics, increase fluid intake, and the patient should be fine in a few days.
Well, if it's a simple UTI, then we can manage this easily.
I sure hope so. Thanks, Tracy. Finally got to the bottom of that tricky case.
Congratulations, Hawks. It must have been quite a relief for the patient.
If only I hadn't been surrounded by a bunch of incompetent doctors, this whole mess could have been avoided.
Wait, what do you mean by that? You were the one who initially misdiagnosed the patient.
Well, my team should have caught that mistake sooner. It's not solely my fault.
But you were the one who signed off on the wrong diagnosis, Hawks.
You know, maybe if you had just listened to the paradox about the monkeys and typewriters, we wouldn't be in this mess.
Whatever that was reckless. Hawks, you can't blame this on a theoretical scenario.
This wasn't theoretical. I went to Sloan Kettering's zoo and worked those primates overnight to reproduce his works.
Hawks, if those monkeys existed, the only thing they probably typed was a version of Shakespeare's Julius Caesar involving feces slinging.
Wow, it would finally be something that translates to your intelligence.
Get the hell out of my office and take this stick figure drawing of what Sloan Kettering probably looks like in your head out with you.
Sloan Kettering isn't real. Drop the delusion, Tracy. We all have to grow up at some point.